Hi, everyone. Thank you for joining us. We're just going to give everybody another minute or so to join and come in from the waiting area, and then we'll get started. Okay, we're at about 4 or 5 minutes after, so I think we can go ahead and get started. But thank you, everybody, for joining us for this information session for the Master of Science in Addiction Policy and Practice at Georgetown. We're excited to have you here and to tell you more about the program. We're going to start out with introductions, and then we'll talk about a variety of topics, including talking about our faculty, staff, and our curriculum, as well as talking about careers in addiction policy and more details about the admission process. So I will get started. My name is Elizabeth Clark. I'm the program coordinator for the Addiction Policy and Practice program. So my role is to be here to help you through the application process, as well as support you on the administrative side of things once you become a student. And I'll go ahead and let the rest of the team introduce themselves. Dr. Myers, would you like to start?
Hi, Adam Myers. I'm a longtime member of the Medical Center faculty, and I help out with the Addiction Policy and Practice program in various ways, including possibly advising anyone who is looking at careers that might involve science or medicine ultimately as part of their interest in this field. Regina?
Right, thanks. My name is Regina LaBelle. I'm the director and also teach in the Master of Science in Addiction Policy and Practice. And I'm an attorney by training. I'm also affiliated with Georgetown University Law Center. And with that, I will turn it over to Sazula.
Hello, everyone. Welcome. So my name is Sazula Bidan, rhymes with Missoula. I am a graduate. I was in the second cohort, graduated at the end of June last year, so I can answer any questions you have about this amazing program. I'm also a person in long-term recovery, an attorney, and I'm glad you're here, and I'm open to any questions.
Awesome. Thank you, Fazila. All right. Regina, would you like to get started with introducing the program?
Great. Thanks, Elizabeth. So really, this program started in our first class. Our first cohort was 3 years ago. And it started because I have spent a considerable amount of time in both federal government and in city government. And in these positions, I recognize that our approach to addiction and addiction policy in particular is based on often based on myths and anecdote rather than science and evidence. And also, that often our science and evidence is not necessarily connected to policymaking. So you may know the research, but you don't know how to get policy done. You may know the policy avenues, and you don't really understand the research of addiction policy. So the idea of this program is really to build the addiction policy field. This is a fairly small field. But we're really delighted to have 3 cohorts so far of individuals who are really going to lead and build an evidence-based addiction policy field both today and into the future. So that was the premise for why we had this program, and I'm sure Sazula can speak to that further. So this is a 1-year program, and we wanted to make it 1 year. First of all, to reduce costs, and because it's July to July, it's 30 credits. It's a pretty condensed program. 27 of the courses are core courses and we'll go over what that looks like in a minute. And then you have 1 elective. And in the capstone project, this is a topic of the students choosing on a number of topics. And we've had students write about, and it's the culmination of the program. We've had students write about the need for grief counseling for people who have lost loved ones to addiction, to medications in jails and prisons, and also collaboratives with licensing agreements to allow for more addiction treatment workforce professionals. And there are full and part-time attendance options. So if you're interested in the part-time option, you just need to indicate that on your application. Next, please. So our faculty is comprised of, so I teach an integrative seminar, which is a year-long seminar. I also oversee the capstone project. Shelley Weissman is a professor who teaches addiction and mental health law and policy in the spring semester. Dr. Compton is the Deputy Director of the National Institutes on Drug Abuse at NIH. He teaches Foundation of Addiction Psychiatry 1 and 2, the year-long program. Next slide, please. And then Dr. Myers, who you've just met. Dr. Amanda Lattimore teaches social epidemiology and addiction in the fall. Dr. Brandon Del Pozo teaches in the second summer program, Comparative Approaches to Addiction Policy. He is a former law enforcement professional. He was a chief of police in Burlington, Vermont, also worked for NYPD, but he's also now a researcher and professor at Brown University. Next slide, please. And then Emily Einstein, Dr. Emily Einstein is also at the National Institutes of Drug Abuse. She teaches fundamentals of neurobiology in the fall. Dr. Talid El-Sabawi teaches our course in the summer, in the first summer, on US addiction policy. So it's kind of a survey course. And then Dr. Chris Jones teaches data and statistics of drug policy in both summers. And, all of our professors are people who practice in the field. They are really leaders in the field, and several of them are people with lived experience. So they also bring that to their studies and to the classroom. Next slide, please. This is the full-time schedule. So as I mentioned, the first summer is healthcare finance, and Beth Connolly, who just left the Office of National Drug Control Policy, will be teaching that this summer. Healthcare finance is really very specific to addiction funding. So how is the addiction framework in the United States, prevention, treatment, recovery supports, how are those funded? US addiction policy I just mentioned, and then the data class. Those classes are remote because it starts in July, and we want to make sure students have an opportunity, if they're relocating, to settle in. And then in the fall, when they have neuro, integrative seminar, and then addiction psychiatry, as well as social epidemiology, those classes start mid-August. Those are in person. In the spring, students are now taking addiction and mental health law and policy. We have the integrative seminar, Dr. Compton's class in addiction psychiatry, and then students have an opportunity to take courses from a number of programs, including at the McCourt School of Public Policy at Georgetown. And then the second summer is students are working on the mentored capstone. They have the second half of the 1.5 credit course in data analytics and data analysis and statistics, and then the comparative approaches to addiction policy. Next slide, please. And this is the part-time schedule. So we've had one student who's already completed the part-time program. We have another student who is now taking the part-time program and is in the middle of it. So this is a 2-year course, and so they take about 2 classes a semester, ending with the mentored capstone in the second summer. Next slide, please. So all of our students are employed in various addiction policy nonprofit organizations, government entities around the country. This is a picture of our first cohort student, Ben Freyfeld. He works in the Office of Opioid Response Programs in Maryland, the state of Maryland. And on Overdose Awareness Day, he trained the governor of Maryland and the lieutenant governor of Maryland on naloxone, how to use naloxone. So people are employed all over, as I said, American Society of Addiction Medicine. We have 2 former students, alumni who are there, American Psychiatric Association. One of our students is employed full-time at the Office of National Drug Control Policy, and several of our students have been and are now interning there. National Association of Addiction Treatment Professionals, DC, New York State, as I said, state of Maryland, and then we also have 2 students who work in Children and Family Futures. And then we also have a few students who have gone on to get their law degree or other degrees. Next slide, please. Over to you.
I'll take over and talk a little bit about where we are in the admissions process right now. So if you are interested in joining us in the summer of this year, 2024, we are currently reviewing applications and are still taking applications until April 1st of this year. Things that are involved in the application. So there is an application fee, which you will pay before you submit the application at the very end. It's an online application that's linked on our website. You'll upload any documents that you need to attach, like your resume or CV, depending on your background, and as well as transcripts from any university that you have attended. Even if you didn't earn a degree from a particular institution, if you took a few classes there, we'll still need a transcript from that university. For the purposes of our review, normally an unofficial transcript is fine. So if you think it may take a while to get an official transcript, or if you have any questions regarding that, for the review processes, typically an unofficial transcript is acceptable, but we will need official transcripts after you are admitted and come to join us. There are also 2 personal statements, or 1 required personal statement and 1 optional statement, which I'll talk a little bit more about in a second. If you are an international applicant or you attended a university where the language of instruction is not English, you'll need to provide some type of verification of English proficiency. So that can be most commonly in the form of test scores, and you can find details about that on our website, as well as the Graduate School of Arts and Sciences admissions website, about what scores that we are looking for and acceptable ways to submit your scores for review. And like we said before, courses begin in July 2024. So that's something to keep in mind. It is, if you're applying around the April 1st deadline, it can be a quick turnaround for when you're starting. But like we said before, the first summer is virtual. Okay, so this is the prompt for the first academic statement of purpose. This is required. We're shooting for about 500 words here, talking about your background, why you chose to apply to our program, how your experience brought you to this place, and what you're looking to get out of the program, as well as how your academic or professional experiences have prepared you for graduate school. There's also an option for an additional statement if you feel like 500 words, isn't quite enough to capture everything that you want to include in your application. This optional statement is a place for you specifically to talk about your personal background and how you think you would contribute to our community here in the Addiction Policy and Practice Program, as well as Georgetown as a whole. So you can use that space to talk about any background that you feel is important to include, or experiences that you've had that brought you here. And again, this one is not required, but we would really encourage you to complete it. We don't require a writing sample for our application, so we really look at the personal statements as a way, to gauge your preparedness for graduate level writing and to get to know you in your own words through your application. So now in terms of funding, so one of the great things about our program specifically is that all students in the Addiction Policy and Practice Program receive a discount on the general graduate student rate at Georgetown. It's an approximate 30% discount, making our per credit tuition rate $1,680 per credit, or a little over $50,000 for the entire 30 credit program. And there's nothing that you need to do. There's no separate application to apply for that discount or anything additional that you need to do. That is a benefit that is applied to all students in our program. Because we have a discounted tuition rate, we do not offer merit scholarships from our program on top of that discounted rate. But our students typically finance their time at Georgetown or their degree from a combination of sources. That can be through federal student loans through the FAFSA or free application for federal student aid. You can also, depending on your level of financial need as determined by the FAFSA, you could also be eligible to receive federal work study through the FAFSA, where you can apply for federal work study positions on campus. If you are affiliated with the military or believe you may have any benefits relating to that, GU Veteran Services offers one-on-one sort of like coaching through the benefits process, so they can sort of help you determine what you may be eligible for and how it would apply to our program. There are also lots of external funding sources that you can apply for. Georgetown has a sort of streamlined process for searching for external scholarships because it can be kind of daunting. There's a lot out there and it can be time consuming to sort of tailor it down to things that are applicable to you and where you're applying. So once we distribute these slides after following the webinar, you'll be able to use these links and learn more about external scholarships that you may be eligible for. And also the Office of Revenue and Receivables offers payment plans too, that you can set up depending on what makes the most sense for you in terms of tuition. Okay, I'll turn it back over to you, Regina.
Thanks. So, this is it's a unique program. It's the only one of its kind in the country. There are other, clinical programs that train people how to be clinicians. There are other research programs that train people to be researchers. Our program is really focused on taking evidence and turning it into action and how to do that. So, because of that, we make sure that our students know opportunities in the community and engage them where they can on distributing naloxone. On the upper right hand corner, students were able to attend an event at the White House during Recovery Month, which is in September. That's 2 of our students there. We had students who were marching at the SAMHSA Walk for Recovery, again distributing naloxone. So, we provide these opportunities and information about these opportunities to students as much as possible so that they can take advantage of, the robust community in addiction policy that exists in DC and the area. Next slide, please. We have also annually, our students have attended the RX Summit in Atlanta, Georgia. It's a large convening that began about over a decade ago when it was specifically focused on prescribed drugs. Now it's a general addiction policy summit that occurs. Many of our students and faculty attended. We also have, we work with Georgetown University's Medical Center's Hoya Dope Project. They are a group of medical students who distribute naloxone in DC and the surrounding community. And then we also in our class, because our integrative seminar, because we're in Washington, D.C., we have opportunities to have speakers from a variety of government agencies, as well as often authors who speak about on a variety of topics. So this is Tim King, who is an author who writes about faith and addiction. We've had speakers from a medical professional in Washington, D.C., Dr. Chapman has spoken. We've had regulatory professionals speak, as well as people who are active in the recovery movement, harm reduction movement. We had an individual speak last year who is a leader in her tribal community on harm reduction. So we really try to take advantage of, the fact that we're in DC, as well as the fact that this is a unique program, to expose our students to various guest speakers, not only so that they learn from them, but also it's a great networking opportunity so they can have the opportunity in the future, if they're interested in employment, to speak to any of our speakers. Next slide, please. So last year, our cohort 2, Sazula's cohort, started a program called Hoyas for Recovery on Georgetown's campus. And that program, as it began with our students, but also with other students at Georgetown, to provide an opportunity for various recovery programming on campus. There's also been, our students go to Georgetown's basketball team to see the mascot, which is named Jack. And then also Hoyas for Recovery has held various opportunities around campus for options for people who may be in recovery, or people who are not interested in drinking alcohol on campus during various days. So there's lots of opportunities to be involved in campus communities. Next slide, please. So as you can see, I want to actually turn it over, perhaps before we take questions, to Sazula to see if she wants to add anything from any of our slides, talk about her experience, and answer any questions that you may have. So Sazula.
Thank you, Regina. Let's see. One of the biggest benefits of this program I found is the exposure and introduction to all of the leaders in the field. You saw the slide about the instructors, Wilson Compton, there's the deputy director of NIDA. Regina, Adam, all these people who are truly tapped in at the highest levels to addiction policy. So that was a huge asset of the program. And another thing, I'm just kind of doing it as it comes to mind. Another thing I would really recommend is you have the opportunity to get a mentor. You can get a personal mentor as well as a capstone mentor. I highly recommend you take advantage of that. By doing that, I've built incredible relationships with people in the field that continue today. What else? I worked full-time the first probably 2/3 of the course, and I was taking the program full-time. It was a lot. I don't recommend that. However, it was doable. And I can't think of anything else off the top of my head, but I'm open to questions.
Thank you. And I think it's good for folks to know that, people have worked full-time and taken the program full-time. It is, it's not easy to do that, but it's possible. But we try to make sure that, we pay attention to the students' needs as they proceed. So there are a couple questions in the chat. And we do not have, thank you for your question, Mohammed. We do not have fully funded scholarship programs at this time for domestic or international students. We have reduced prices, but it's obviously, we still understand that's quite a bit. So there are, I'm at the O'Neill Institute, we're looking at possible options for shorter term training programs there. in this field, but at this time, we don't offer full scholarships for domestic or international students. Any other questions?
So I would add for Mohammed that there may be opportunities that you can identify through your own community or nation or workplace, local or state government, where you are. Oftentimes students that come to programs in the United States from abroad have those types of scholarships. So I would ask at the university you attended, maybe the organization you work for, community service organizations, etc.
One of the questions was, and Adam answered, about how large the cohort is. So the first and second cohorts had 12 students, one part-time. This cohort has 10. And we anticipate it'll be less than 15, at the most up to 20, but probably, less than 15. Our, the demographics vary from year to year. Sazula already had her law degree. We've had students who have had other degrees. We currently have students who have other degrees, who have, are also taking this program. So, the age range varies from year to year. This year, probably the cohort skews a little bit younger than in the past, or new graduates from undergrads, but it really varies. And we have people with, 10 years of experience who have taken the program.
I'd just like to add to that about the demographics or the composition of the cohort. I found it to be really perfect because there was a wide range of not only, ages, genders, races, et cetera, but also there was variation in the approach and the beliefs that people brought to the program. And so that provided a lot of opportunity for each of us to learn from each other, challenge each other kindly and constructively. So I found it to be an incredibly diverse cohort. Some people have lived experience, some don't. So I found it to be really diverse, and that was really helpful.
Right. And the lived experience varies. Some people have lost loved ones, others are in recovery. It does vary, but it adds a lot to the, we're pretty intentional about the community we're trying to build. So, it adds a lot to the discussions to have people from a diverse set of backgrounds and parts of the country as well who have experienced different approaches to current addiction and drug policy. So it's a fairly small group. If folks don't mind, I'd love to hear from any of you, why you're interested in this program potentially, or what you're interested in doing with such a degree, maybe what you do now. Feel free to go on camera or just, stop in the chat and say. I know Vincent introduced himself in the chat. He works for Community Outreach Coordinator with Transforming Reentry Services. Sounds great. We have, this year we have someone who's a peer counselor at a hospital. And last year, one of our students, after the program, became a peer advisor in a local jail. So we, do quite a bit of work on peer recovery programs as part of the workforce, building the addiction policy workforce.
I'll introduce myself. Hi, I'm Tricia Quinn. I'm the Vice President of Policy and Partnerships at the DC Primary Care Association. I am one of those people who I have a degree in English from 1986. So these are the kinds of things you do when so I don't have a master's. It has not obviously proved a specific hindrance for me in advancing, but I've had curiosity about a range of different graduate programs, public health, public policy. This one because of experience with my own son who had heroin addiction, who has amazingly survived and thrived, and just have seen the kind of hot mess that policy is relative to addiction, a combination of, continued stigma and failure. So, still interested in this particular master's because of just a deep personal interest in improving how we do this work from a policy standpoint.
Great. Thank you very much, and thanks for your work and for sharing your experience. And go ahead.
Oh, sorry. So I'm Brooke. I just graduated from undergrad in May as a chemistry major. So my long-term goal is I do want to attend medical school. But in undergrad, I had an internship at an addiction center attached to a hospital. And so I did that for a semester. But right now, since I've graduated, I'm working at a state-funded detox facility. So it's just been super interesting to see along with seeing the firsthand experiences, seeing what different state funding we get and all the different things that we have to reach Medicaid standards and things like that. And so since getting involved in that, I've done a lot of research and readings on my own because I found it super interesting, how that all goes. And so that's kind of why I'm really interested in this program, because I feel like I got to see the firsthand experience, and I have the science background, but I'm really interested in the policy stuff because I really didn't get to explore that stuff in undergrad. So that's something I'm just interested in.
Great, thanks. Yeah, and most medical schools, as you likely know, don't really teach anything about substance use disorder or addiction. Dr. Myers, I don't know if you want to add anything else about medical school.
Just simply to say that we are well connected with the medical school and can advise anyone who's interested in pursuing that path possibly. There's also the Health in the Public Interest program, which is parallel to this one. And we talk about more health and medical related topics, sometimes including things that have to do with addiction. So yeah, it's not all policy. That's the major emphasis of the program. But as Regina has pointed out a couple of times, it's policy informed by science and evidence. So, yeah.
Great. And someone else introduced themselves in the chat. Social worker, former social worker in Chicago, works on Medicaid policy as a staff member at Georgetown. So great, welcome.
Yeah, and I don't think we got into it much here, but the program is structured so that it's the classwork is not just at random times, right? A lot of it is later in the day or early in the day, and allows for people to have a part-time job or maybe a part-time internship. Being full-time on both ends is probably a stretch for most people, but I think the program is pretty good from that standpoint. Suzula, you want to comment on that? How many of your class were doing something else significant while they were in the program?
So, to the best of my knowledge, most people in my cohort started the program without a job. There were a lot of people who had moved to DC for the program. And it was just kind of the reverse of me, whereas I started with a very demanding full-time job and then quit in February to focus on the program. Most of my cohort members kind of got into either an internship or a position as the program went on. Did that answer the question? I'm not sure.
Yeah, I think so. Do you want to mention a couple of the kinds of things that they were doing?
Sure. Let's see. Well, one of my cohort members has gone to law school. He's in his first year of law school. Another one got an internship about, I don't know, halfway through the program at ONDCP, managing the interns, I believe. And then one of my cohort members who's just brilliant and going to be a neuroscientist and all kinds of stuff, Sean, he was always doing something, some internship or something. He was totally impressive to me. So you can just do the program if you want. You have the financial ability. And there are tons of opportunities, especially as the program progresses and as you meet people, to get hooked in to internships or jobs or whatever it might be.
So let me, Patricia Quinn asked the question about the timing. These should hold, but I'm going to tell you now what they are currently. So Wednesday, the summer one, Wednesday, data analysis, 4 to 7 p.m. U.S. addiction policy is during the day, Tuesday, Thursday, 1:30 to 3:40. And then healthcare financing, Monday, Thursday, 5 to 7. In the fall, neurobiology and foundation of addiction are both in the evening, Tuesdays and Wednesdays, 5 to 6:40 or 5 to 6:15. My seminar, I teach it every Friday from 2 to 4:45. And then social epidemiology and addiction is 5 to 7:30. So with the exception of my class in the fall, everything is 5 o'clock or later. In the spring, addiction and mental health law and policy is at 3. Foundation of Addiction 2 is at 5. And then again, my seminar is at 2 on Fridays. The policy elective varies. In the summer, data analysis and statistics, 2:30 to 5:30 Wednesdays. Comparative addiction policy, he splits it up into 2. So Mondays, 4:15 to 6, Tuesday morning, 9 to 10:45. And then the mentored capstone is on Fridays starting at 2. That's a little bit more flexible the second summer because you're doing work on your own. But the majority of classes are taught at 5-ish. And full-time to part-time, yeah, it is flexible. They give you a certain number of years to finish the program, and so would be staying in touch with Elizabeth, getting advice from, Dr. Myers about classwork, etc. All right. Any final remarks, questions? Okay. Elizabeth?
Yeah, thank you guys for joining us. We'll be sending out a recording of this webinar shortly after we conclude, and I will also include a copy of the slides with all of the links that I referred to as well. If you have any questions or want to meet with any of us one-on-one, feel free to email us. Our program email is addictionpolicy@georgetown.edu. Yeah, happy to meet with you or address any other questions that may come up afterwards. But please stay in touch, and thank you all for coming.
Thanks so much. Have a great day.
Thanks, everyone. Thanks, Suzula.
Bye. Thanks, Suzola.